Hello.
Hello?
Hi. Mary Ellen from St. Mary's.
Okay. Just Nicole. I know that, okay, I'm going to put you back on mute, but I will
I
introduce.
just want to let you know I'm calling in, and I'll be doing I'll also do the webinar on the computer because I don't have a speaker or camera or anything. So
Okay, so, and you'll be talking as well, right?
I think I'm just going to do the first slide just to do an intro to St. Mary's County, just very brief, and then Marge will take over.
Well, at least I know that you're calling user 2, so that's helpful. I wonder if there's a way to name you.
Okay.
I can rename it. Awesome. I'm going to name you so then I know.
No problem.
Perfect.
Hi, Nicole, can you hear me? This is Denise.
Yes.
Okay, great. Yay, it works. Okay, I'm going to mute myself again.
Perfect.
And by the way, good afternoon.
Same. I can't see you right yet because I'm doing something, but
I think I have my camera off. We're not supposed to have our cameras on, are we?
no.
Okay.
But you can turn it on if you want when you present.
Um, if everyone else does, I will, but if it's not needed, I don't.
People can see it's a very small screen if you're concerned, but you don't.
Aren't we all a little shy? All right. Well, great. I'll do that once. Do you have an order for us, or it's just going to be whoever's on the phone?
Everyone's hearing this, but you guys will be the first to present. So I'll share. You'll see how on the screen on the PowerPoint. So.
Sounds good. All right. I'm muting myself. Thank you.
Mhm. Make sure you're muted. Everyone should be muted, but mute your computer if you're not. I put a note, but if as people are entering, if you want to just introduce yourself in the chat box so we know who's on the call. Thanks. Okay, so it is 1 o'clock, so we can probably get started. Just as a reminder, I have muted you all as you enter, but if you have your video on, you, you don't necessarily need your video, so you can turn your video off. That might help with some of the background noise. So there is. And just if you, yeah. Okay, I'm trying to mute everyone that wasn't muted. Okay. So everyone can see my screen, correct? And we can get started. So, like I said, as you get a chance, when you when you sign on, if you just want to say your name and where you're from in the chat box. There's a lot of us on the call, so we don't need to introduce ourselves. That would take too long. But welcome everyone to today's program evaluation community practice call. We hope this will help you get a little more background on evaluation and how to implement evaluation in your jurisdictions. So real quick, just a quick update on BHRT as a reminder. So we are the Behavioral Health Resources and Technical Assistance Program at the University of Maryland School of Pharmacy. We provide technical assistance to help guide the communities across Maryland in addressing substance use and abuse prevention issues. Our mission is to improve public health by bridging the gap between research and practice through technical assistance and evaluation. So as a reminder, things that we can assist you and the jurisdictions, you as the jurisdictions with data collection and analysis, GIS and mapping, survey development and dissemination, focus groups and key informant interview support, research methods, as well as IRB requirements and study protocols. And that's a link to our website, just as a reminder. So now we're going to have our team introduce ourselves. So I'm going to so our team can unmute themselves and then introduce. So Dr. Shire first.
Yes, hi, thank you, Nicole. And I just wanted to welcome everyone. My name is Fadia Shaya, and I am the Executive Director of the BHRT team, BHRT. And we're delighted to have you here. I look forward to hearing from you today. And I'm always very thankful to the team, and they will introduce themselves. And before I stop here, I wanted to thank also Brooke Holmes and all the collaboration that we have with the state and with you. So with this, I look forward to our session, and I will be on. I will go to silent now and hand it over to the team to introduce themselves.
So once again, hi, I'm Nicole Silfa. I'm the Associate Director of BHRT.
Hi, this is Sade Jones. I'm a program specialist with BHRT. Hi, this is Vanessa Michelle, and I'm a program specialist with BHRT as well.
Next, we have the Office of Population Health and Improvement to, getting that, to introduce and welcome everyone. Brooke? You're there.
Can you hear me?
Mm-hmm.
Oh, okay. Good afternoon, everybody. My name is Brooke Holmes, and I am a program administrator in the Office of Population Health Improvement under the Public Health Services Administration within the Maryland Department of Health. I do not believe that Latiqua Holly is on the call as yet, as she had a scheduling conflict. She'll be on later. But Latiqua Holly is currently serving as our regional coordinator for the Eastern and Southern regions. And then I believe that Costella is on the line, and I'll allow her to introduce herself.
Good afternoon, everyone. My name is Costella Davis, and I'm the regional coordinator for the Office of Population Health Improvement at the Maryland Department of Health.
Thank you, Costella. And Costella is helping us with the Western and Central regions of the state. And so many of you know me. I've been working with the Maryland Department of Health for 5 years now. However, you know, last year we transitioned over to, we used to be under the Behavioral Health Administration, and last year we moved over to the Public Health Services Administration under the Office of Population Health Improvement. And just a little bit more about the Office of Population Health Improvement, as many of you may not know, and I don't believe that we've really ever even shared this, but the Office of Population Health Improvement seeks to transform public health through the stewardship of data, partnerships, and various funding initiatives that then help us to develop innovative health policy, programming, and improve the health infrastructure of Maryland. Our director is Dr. Cheryl DePinto, and our deputy director is Kimberly Heiner. As you all know, we oversee a few prevention, various programs, but within the local prevention unit, we oversee the Prevention Services Grant, formerly known as the Substance Abuse Block Grant, the Strategic Prevention Framework Partnership for Success Grant, formerly known as MSPIF 2, and the Opioid Misuse Prevention Program, also called OMPP, and the Overdose Fatality Review Program. Additionally, we are overseeing the activities of the Overdose Data to Action Grant with as it relates to the activities that we do in our office. So one, I want to just thank the BHRT team for continuing to be our partner and provide the technical assistance that they have provided to you all throughout the years. They do have a great team. And so we want to make sure that we utilize them to the fullest extent that we possibly can, and that includes you all reaching out to them to get guidance and technical assistance around you know, implementation and the various other activities that they do. And so first and foremost, let me come to you all saying that we are fully aware that this is probably the first time that you are either seeing or hearing from us in a very long time. And we just come humbly saying that we apologize, we understand, we are sorry for any neglect that you may have felt over this last year or so or more. We intend to change that and to change that perspective. And some of the ways that we, as you all know, some of the ways that I will let you know some of the ways that we are doing that. But just to let you know that our office is now down to 3 staff members, as you see again on the screen there. As of March, we lost Shayna D and Jalyn Pelton. who were working on the Western and Central regions. And so with them being gone, we've of course readjusted what we are doing, but we can assure you, even with our limited staff, that and capacity, that we are putting measures in place to make sure that we provide you all the technical assistance and guidance and grant monitoring that you all need. And we know that first that starts with communication. And with regard to communication, we transition over to public health services, there has been some differences in how we communicate with you all, just restrictions on kind of what we can send out, when we can send out, whereas previously we had a little bit more free reign, let's say. And so with that, some of the ways that we're trying to work on that is to completely rectify kind of the debacle from FY20, in which you didn't really receive any guidance or direction from us on your FY20 plans. We certainly did do the work to review them to make sure that we could provide you that feedback, but just with everything going on, some things were some processes were not followed through. Let's say it like that. And so with that being said, one of the ways that we are trying to alleviate some of that is by having these technical assistance calls that you all signed up for to assist you with FY21, to reassure you when we send out the guidance for when we send out the application with the feedback for FY20, it is not by any means to ask you to change anything that you have done or were doing for FY20. It really was just to show you things that you could work on for your FY20 application during this time, so that there isn't a lot of back and forth that we have to provide to you. So it's us trying to get in on the front end here, provide you the guidance and support that you need so that you can, so that we can effectively and efficiently move through providing you approvals for your application. So we're hoping to work out all of the kinks so that when you submit, that the time between when you submit and approvals is a little bit more appropriate, so that you can start on July 1. Other things that we are looking to do in FY21 is to have quarterly check-ins with each of you. Additionally, we will be doing at least once a year site visits. Additionally, we will also be looking to bring back the prevention network meetings, potentially having maybe at least 2 in FY21. Again, just reminding you all that this is all dependent on what our lives will look like with regard to the current crisis that we are all dealing with and experiencing. So with that, with regard to the crisis, I really just want to say that I want to encourage you all to keep on doing what it is that you are doing. We understand that FY20, there have been some barriers for various reasons, and now including what's going on with COVID-19. I want to encourage you to reach out to us to receive guidance and technical assistance, and especially the BHRT team. Because we do have some ideas. We don't have all the answers, but we will do what we need to do and be resourceful in finding you some. But we do have ideas, and I have spoken with a few jurisdictions and provided guidance on how to maintain continuity of your program implementation during this time. So reach out to us, let us know what the issues are, because we don't know what we don't know. And if you're not sharing with us, we don't know. So please always feel free to reach out to us and communicate with us what you may be dealing with and struggling with. Remember that you have the opportunity to do budget modifications to move money around, and I'm sure many of you have to do that. I know that I've received some, but not many, but I'll assume that for those who have not submitted, that maybe you've worked through some things and are able to continue on. But please, again, we know that it's been difficult. We know that it's been hard. Just again, continue to do what you're doing, and feel free to reach out to us to get the support that you need. And I probably have taken up a lot of time, and so I'll stop there. Lastly, sorry, the communication with regard to anything prevention, we ask that you please send information, questions to the ophi.prevention@maryland.gov account. You can include the particular staff members like myself, Latiqua, or Costella on that correspondence. But one of the ways that we can be better about our communication with you all is by you sending it there, because then there's an opportunity for more people to see it. It doesn't get lost, especially with the added responsibilities that I now have. It doesn't get lost, and my staff can assist with triaging those inquiries. So please, please, please send information to the ophi.prevention@maryland.gov inbox, and you're welcome to copy us on those as well. I don't think, Nicole, that I missed anything from our conversation, and Costella, please let me know if I missed anything, but I think I captured it.
I think so.
Yep, I think so.
Thanks.
Okay.
Thank you.
All right, so. You broke on the video.
Oh, do you want me to close my video? I can do that.
Yeah, that's good. So then, yeah, thank you. All right. So thank you, everyone. So for today's objectives, just as a reminder, is to just go over program evaluation, the what, the why, and the how. And then also we have you'll be able to learn how the evaluation process is being implemented in Calvert and St. Mary's counties. They'll be sharing some of their evaluation tools and lessons learned that they can hopefully provide you with some guidance and answers to questions. Real quick before we move forward, I just wanted to say that if you have any questions, so please put them in the chat box. That way we can keep everyone on mute, and I'll just read the questions out loud to the jurisdiction so that they can answer them, or if you have any questions for us, or if you have any questions that you want to put in the chat box for Brooke and her team. So just put those in that chat box and that'll be great. So I am now going to turn it over to Vanessa.
So what is program evaluation? Program evaluation is a systematic method of collecting, analyzing, and using data to determine if a program is effective or not. The two common types of program evaluation are process evaluation and outcomes evaluation. Process evaluation documents all aspects of the implementation of intervention. It monitors the outputs of the strategy, and it determines whether a program's activities were implemented as planned. You will need to select measures for various parts of the process evaluation. For each component, you should also consider tools and resources required. These will include how you will collect, store, process, analyze, and disseminate information about participation, relevance of messaging, exposure, and fidelity, in addition to how you will use the information when interpreting your outcomes. Outcome evaluation documents whether the strategies made a difference, and if so, what changed. The outcome evaluation measures the changes to your selected contributing factors, intervening variables, and priorities. Outcomes are changes that occur as a result of implementing a strategy. You will need to develop short-term, intermediate, and long-term objective measures for your outcomes. For each outcome, you will need to determine how they will be measured, how often they will be measured, and who the participants will be. Additionally, you should also consider the tools and resources required. Next slide. Next slide. Okay. So why do we evaluate? Evaluation used to monitor the implementation and outcomes of a program. When you evaluate a program, you can determine if you need to make any changes. This process contributes to continuous program improvement. And remember, evaluating a program will help to identify if the program is effective or not, identify if any changes need to be made, report results to stakeholders, gather evidence, and provide data that is beneficial when applying for grants. Next slide. Next slide.
A change.
Oh. Oh, okay. So how do we evaluate?
Yeah, okay.
Measures are used to evaluate different parts of a program. Tracking measures ensures that the program is being implemented as planned and helps with achieving the program's objectives. Two of the most common types of evaluation measures are process measures and outcome measures. These measures focus on different aspects of your evaluation and can help you answer many types of evaluation questions. Process measures determine if specific program strategies and activities were implemented as planned. Process measures can address the following questions. Did your program meet its goals for recruitment of program participants? And did participants receive the specified number of service hours? A process evaluation provides feedback to answer why and assess if any key measures are not being met. Outcome measures focus on changes in comprehension, attitudes, behaviors, and practices that result from a program, project, or policy. Outcome measures can include both short and long-term results. Remember, process measures are often collected throughout a program's implementation, whereas outcome measures may be collected less frequently. However, you may need to collect baseline outcome measures that will be used to compare your outcome measures to. Next slide. Okay. And lastly, BHRT has created the IT program evaluation, and it can be found in the resource section of our website. This guide explains what program evaluation is and the importance of evaluation. It also provides examples of process and outcome measures and evaluation surveys. And as always, you can always reach out to the BHRT team if you need any TA. Next slide. Next, we'll have Calvert County and St. Mary's County present about their evaluation process. First up, Calvert County.
Denise, you unmute yourself. You're good.
Good afternoon, everyone. Ashley, are you on the line? I'm not sure if Ashley's having some technical problems on her end. If she doesn't get on the line momentarily, I'll start the presentation. Here's something. Okay, why don't I go ahead and start the presentation, and then if Ashley and Kirsten are able to get on the line, I'll hand it over to them. My name is Denise.
I'm on, Nicole. Yes. Kristen.
Ashley?
I'm Kristen.
Hi, Kristen.
Hey.
All three of us are presenting, so I wanted to make sure we're on the line. Is Ashley on the line? Okay. Sorry for the delay, guys.
Audio isn't working.
Her audio's not working.
Can she call in, Nicole, at all? Is there?
There's a call-in number if you wanted to call in, Ashley.
She's on it. Okay.
And that's many things. Okay. Sorry, everyone.
Enter your access code or meeting number followed by pound.
Did you want to start, Denise, or you?
Certainly can. So anyways, let me introduce myself. I'm Denise Maple. I'm the grant evaluator for Calvert County. And all three of us put together this presentation wanting to give our different perspectives. Ashley Staples is the prevention coordinator, our mighty leader. And Kristen, are you on the line?
Yes. My name is Kristen Lambert. I'm the prevention outreach worker.
So would like to go to the next slide, Nicole?
Oh, Ashley, try and start talking, and then I can tell which call-in number you are. I'm just going to unmute a couple and then see. It might be this.
Can you guys hear me?
Yeah.
Yay! Hi, Ashley.
Hi. Sorry about that. I don't know what's going on. So did we start it all? Or should I just kick it off?
Just introductions is all I did.
Okay, cool. So yeah, so my name's Ashley Staples Reed. I'm the coordinator, and then you have Denise, and then you have Kristen. So we can just move forward. Okay, so we have all three grants that Brooke had mentioned. So we have the SPIF grant, we have the OMPP grant, and then we also have the block grant. We're going to highlight some evaluations from only the MSPIF and the OMPP, simply just because block is so new. We really haven't done any concrete evaluations. So next slide. So how we develop our evaluation plan. So during the needs assessment and the strategic planning, we do a lot of stuff. Now, I do just want to highlight that I think what Calvert has that I don't think a lot of jurisdictions have is a continuous evaluator. So we've had Denise for almost 5 years now. Is that correct?
Yes, it is.
Yeah, and I think that has really like made things so like fluid and easy, you know, and comprehensive. So I mean, that's not something that you guys can really control if you have, you know, continuous evaluators, you know, going in and out. But I definitely think that's contributed to a lot of our successes. So beyond that, we know during this needs assessment and the strategic planning, we do a lot of data gathering, whether, you know, it's key informants or focus groups and things like that. So then that's when we identify the needs and the gaps, and then we figure out how to do the strategies in order to address those needs and the gaps. And then we figure out how we're going to measure that. And then, you know, how we measure it is going to be on how we process it, you know, and how we're going to evaluate our progress. So what I'll do is I'm going to hand it off to Kristen. That way she can go over some of our process measures and how we track them. That way it's a little bit more fluid and a little bit easier for Denise in order to get her evaluations and get her reports together. So Kristen, you can go ahead.
Thank you, Ashley. All right, so our process measures tracking, we use an online Google Excel spreadsheet, and with that, we are able to track the number of events or trainings conducted, the estimated number of people in attendance, the count of print materials, disseminated impressions from media campaigns, and the steps taken in the meetings that we've had with partners. This allows us to input information quickly, and it's compiled for the reports provided biannually for the state. And when we compile this data, we realize how much work has been done in such a short period of time and how many people in our community that were impacted. Next slide. So here we've attached an example of our tracking spreadsheet. We break it down by grant and then by month. So you can see we have example event dates, event names, the impressions, and people reached at the events. The last three fields are examples of initiatives, and we put a 1 if we touched on that initiative at the event. For evaluation reports, Denise calculates the number of events and people reached. And that's it.
Hi, everybody. This is Denise. and I want to talk about some of our outcome measures. So first, but actually going back to the process measures, when the team came up with this spreadsheet, it made my job a whole lot easier. And it's really neat because they can input this data, the day after each event, and it really helped us to compile the data much more succinctly and easily. So if you have the ability to put together a Google spreadsheet like this that everyone can contribute to and access, it's really a great tool. So now looking at the how we develop outcome measures. So we all have our logic models, and first we have utilized over the years the MPOS, the MISA, and the YRBS surveys. And this has been really helpful to give us data over multiple years and to compare data at our local level with statewide data. So for instance, if we see that in 2016, 30-day use of non-medical use of prescription drugs spike in 2018 compared to 2016, or if the number of youth saying that they are driving while intoxicated spikes or declines, it kind of gives us that broad picture. So some examples that we get from those data sets are, again, the 30-day non-medical use of prescription drugs. That's in our OMPP grant. Proper storage and disposal behaviors. That is also in the OPP grant that we utilize that data. Reporting of binge drinking behaviors and perception of risk of driving while using alcohol. Those are just a few. It kind of gives us this outline of what we are possibly seeing in the community. And it sort of brings up curiosities like, why was there a spike there? Or why is it higher in our jurisdiction versus across the state? And then we can go into the local level data. That's when we start thinking about, well, what sort of surveys can we do at the local level? Or what sort of data sources can we get from the school or the police department that can help to fill in the blanks a little bit, paint a little bit more of a picture or the story for what is happening in our community and why. So again, the big surveys kind of give us the broad outlines, and the local level data sort of kind of like colors in and gives us a little bit more detail. Next slide, please. So we're going to go through 5 different local data sources that we've used over the last 5 years in our grants, just to give you kind of a background when we talk about collecting local data. And sometimes it can be very time, take a lot of time to collect. And sometimes it's actually, we incorporate collecting data when we're actually doing some outreach already. And that's when it really actually is very helpful. So the first one is our Youth Perception of Risk Survey. This survey is administered yearly at all of our public high schools during lunch. So our staff goes in during lunch, and we set up a table, and we offer candy and giveaways, but we make very clear you can get candy and giveaways regardless of whether you do the survey or not. And initially the survey asked questions about opioids, but later, again, some kind of what we were starting to see through various data sources, we decided to expand the survey to include other substances. So we went back through IRB and just added a couple of questions and expanded it, and that turned out to be very helpful. So between 2016 and 2019, 773 surveys were completed by students. It was has been a very good data set. We had wanted to go in for 2020, but obviously that's changed. But we'll continue the survey into the future as things begin to stabilize. And the result is we have a steady, so here's one piece of data that was helpful. There's been a steady increase in youth perception of the dangers associated with non-medical use of prescription drugs. So it rose from back in 2016, 53% said it was very risky. And then when we got to 2019, over 75% said it was very risky. So again, this is giving us some really good data. Next slide, please.
We have a question in the chat box that I can answer.
Okay, so the question is, how are you able to get parental consent to administer the survey in the schools?
So what Calvert does, and I don't know if other jurisdictions utilize this, but what happens is in the beginning of the year, during, all students take home folder or what have you, there is a blanketed consent form stating, throughout the year, various agencies are going to come in and they may question and do questionnaires and surveys for your student or for your child, and then it gives them the option to opt out of that. So it's kind of a blanketed consent form that we don't even need to physically get ourselves. So that has been a really good luxury that the public school system here in Calvert has utilized for us to be able to just go in and, survey and question students that are able to do that.
Thank you. So that's something people can look into if that's a possibility. So.
Yep, that's perfect.
Perfect. Sorry.
All right. So
one more. Sorry. Well, I see you guys are asking the questions, and what we'll do is keep on asking them, and then at the end, I will ask them to the team. Keep on putting them in throughout their presentation.
all right. So the Good Samaritan Law survey, I want to start by touching on this statistic that we put in. So overdose data provided by the Sheriff's Office showed a 32% decrease in non-fatal overdoses and a 15% decrease in fatal overdoses from 2017 to 2019. So we wanted to further understand from past and current users if they would use the Good Samaritan Law to prevent fatal overdoses. We first started using the survey at the start of the grant, and then we wanted to, so when we started it at the start of the grant, sorry guys, we would administer it to past users at the detention center. This went on for about 3 months. And then in 2020, we wanted to reassess the survey. So we were able to compare from the past. So now we administer it at a local treatment center during their monthly family night before a Narcan training. And so far, we have 29 responses from individuals in treatment. The average answer so far is that about 90% are extremely likely to call 911 if they witness an overdose. And in 2016, the average for very likely to call 911 was only about 68.9%. And people who were likely to call 911 during an overdose average was 26.6%. So it's definitely gone up. And yeah. Next slide, please.
Okay, another survey that we'd like to discuss is our pre and post survey that we administer during our TIPS training, and this is during the MSPIF-2 grant. So the Calvert team conducts trainings several times a month to employees at local alcohol retail establishments. Some of these trainings are actually at the establishment, and some of them are open community trainings that any server can attend. The TIP survey is administered before and then after the training to determine the training effectiveness. And to date, we've had 745 servers that have been trained in TIPS and have completed the survey. The results have been a little bit surprising for us. The student scores show an overall 7% increase in confidence in identifying behavioral cues, checking photo IDs, and refusing intoxicated patrons alcohol. And we kind of thought 7% was sort of low, so we went into the data a little bit more, and we saw that there's a trend of pretty high pre-test confidence scores. So they come into the training kind of feeling like they know how to do this already. We went back into the data and stratified it because we did ask if this was someone's first time taking the class, and if when was the last time they took a class, and we stratified the data to look at first time TIP students. And really the results were not virtually any different. So really for us, it kind of has become a curiosity, and it's unknown if the servers are, say it like this, are truly as competent as their self-perceptions indicate. So, I've always been taught that all data, even data that is unexpected or you kind of were hoping it was going to look a little different, all data is good data. And so this was good data for us to have, that there's high confidence scores. There is an increase in confidence but just not as much as we were expecting. And then as we go into some of our other surveys coming up in the next few slides, it'll kind of actually paint even a little bit more of a picture of what's happening in Calvert County in this respect. Next slide, please.
Okay, so what we did in conjunction with all of these tip surveys is we also did a server survey. It's an online survey that servers of local alcohol establishments can take. It can be online. I don't think we had printed any paper ones, but we may have, but it was predominantly online via a QR code. So advertisement cards were distributed with that QR code, so it was completely voluntary. We did have an incentive to where you could be entered in to win, I think it was like a $50 gift card. Total, we had 36 surveys, and the results were that a lot of the establishment owners and managers believe that the server training is a valuable tool when it comes to tips, yet a third of the respondents have not taken it, and a fourth of the establishments do not require that employees attend a server training. So it's important to know that Calvert is one of the jurisdictions that only, the law is it's just one person on site at all times. So it's the most lax out of all the jurisdictions because that's the state minimum. So there are going to be a lot of controversy when it comes to whether or not they want their staff trained because they don't have to. But because of that, we saw that a lot of the establishments didn't have house policies that mirrored a lot of the tips training points when it comes to safe serving. So what we did beyond that was we created a house policy guideline and we distributed that to all the alcohol retails kind of in response to what we were seeing when it comes to the server survey. And then after that, we did administer a survey about 6 to 7 months later, asking if they utilized it, if they enjoyed it, if they actually looked at it, if they've created a house policy based off of it, and so forth and so on. But what we did is the surveys were administered about maybe a month and a half ago. So it's in the midst of all of this COVID stuff. So we've only gotten 9 surveys so far. Okay. And then beyond that, we do have our compliance checks because we do know if any jurisdiction is going to utilize the TIPS training, it's not going to be really, it's not going to hold efficacy unless you do have that compliance component piece to it. So we did actually have compliance checks being funded through this grant for law enforcement to go in and do underage compliance checks. So the interesting case was in January to the June 19 timeframe, there was a total of 58 checks. 42 of them were off-premise and 16 were on-premise. It is good to note that this was the first time that on-premise checks were being conducted. And out of those 16 on-premise checks, 10 of them failed, which was really significant. So again, it kind of goes to show if the TIPS training is being done, you need that follow-up, because if there isn't a follow-up, people are going to know that they're not going to, have those potential violations and fines and fees and stuff like that. So they aren't going to abide by all of the guidelines and things like that. So that was really interesting. And then, so beyond that, all the checks, server survey, and tips were there to create a case for it to be mandatory for all staff to be trained in tips. Next slide.
Okay, just some final thoughts and recommendations. So we're all aware that local level data collection can really take a lot of time, and the team is so busy doing a lot of outreach. We're trying to always find a balance. So always try to consider when you can combine surveying with outreach activities. So examples of that is our youth survey in the high schools. The team is in the high schools a lot. So when the students see the team, they kind of already know them. And, going in at lunchtime has been a real asset. Tips pre and post, that's done quickly before the training and after the training. And even our Good Samaritan Law was survey was revived and administered during family night when a NARCAM training was taking place. And a lot of these examples, the team, not me, the evaluator, but the team came up with these suggestions of, hey, why don't we do this? and why don't we collect some data? We have an opportunity to collect data, and I've really appreciated when they said that, so that we could actually get this really great on the ground data. I personally believe data is everything, and or I should say everything is data. Actually, both are true. And so when I am on the phone with the team, especially when we're getting reports ready for the state, I'll often ask the question, well, what are you hearing and seeing in the community? When they're having meetings with administrators, when they're having meetings with the police department, what are you hearing and seeing? And that's really helpful to me because it can lead to expanding current surveys. It can lead to a new question on a survey, or it can prompt me to look at IRBS. Sound. Can everybody hear me okay? Okay, I heard this sound. I'll just keep going.
Not working.
I figured it out. Person. Okay, I got rid of it. Someone on their video.
Okay. So what I was just saying is it's really helpful when we can add, when I know what's happening in the community, because the team is the face and my eyes and ears in the community, then I can go back into IRBS, or I can go back into some of the other surveys and say, hey, am I seeing this trend that they're telling me in the data? Whenever you can share data with your partners and stakeholders, I've always seen it to be such, it creates a lot of cohesion, it creates bonds, it creates trust. So definitely, I'm a believer that data should not be collected for data's sake. And even though we're collecting it because of the requirement of the grant, whenever it can be utilized, instead to say, to our partners, this is what we're seeing, or can you share some of your data with us? I think that's a great partnership when that can take place. And certainly the schools and the police department both have been great partners to us. And then the last thing is when we've done, particularly the process evaluation, and Kristen talked about this, it really helps to show how much work the team is doing. One time I collected data of how many students that they've been in contact with, or their outreach impacted, and it was like 1/4 of all students in Calvert County Public Schools in a matter of a 6-month period. And I just was so excited for them, and I had to share that. So whenever we can use our data also to motivate ourselves and to realize that we really are making a difference, I think that matters a lot. So that's everything. Ashley, Kristen, do you want to add anything?
I don't have anything that I think I need to add.
I don't have anything. I mean, I can address the questions that were there, though.
There are 2 other questions that came through for you guys. For the question that you do at the schools, is it paper-based or electronic?
So it all depends, but for the sake of this slide, the youth perception of risk survey, it was both actually. So we had the paper option, and then we actually had tablets to where students could do it online. It was just a quick Google Doc. And then we also, again, we had a QR code if the students wanted to pull out their own phones and take the survey on their own phone as well. So it was a various platforms. And, if there was a paper version that was filled out, we would self-input it into the Google Doc form. So it could all be collected and reviewed electronically.
Great. And then one other question for that survey, since you had mentioned that, all students have that overall consent at the beginning of the year, that then they are able, if the parent doesn't want them to participate, they opt out. How do you know if a student's parent opted them out when they come to take the survey from you?
So I'll give 2 examples to provide some sense to it. So what happens is if a parent, signs the form saying, I don't want my child doing any surveys, then it gets compiled to a list. So then when the school knows what students are not supposed to be doing questionnaires and surveys and things like that, as well as their teachers. So it's the school's responsibility as we say, hey, we want to come in, we want to do this, this, and this, and we're going to be doing a survey. And they say, okay, you can come into this classroom, but, Johnny and Sue can't take a questionnaire. And, we're aware of that, and the teacher is aware of that. And we'll say, okay, fine. So then there's our restrictions. When it comes to this survey in particular, it's open-ended. So we're not forcing students to come and take it. So if the student is quote unquote not supposed to be taking a questionnaire, then it's the student's responsibility to not take the questionnaire because we're not making them take it. And that kind of covers us because if a student does take it, oh, well, it was voluntary and your student decided, your child decided to take it anyway, so it wasn't something that was forced upon them.
Great, thank you. I don't think else, but if anyone comes up with any other questions, feel free to put them in the chat box and we'll have time at the end for additional questions.
Can I just add something that Ashley
Sure,
just said? So early on, we were just going to the school with just the tablets. And what we found was there was so many students that wanted to take the survey that we didn't have enough tablets to go around during their lunch period. So I do think the fact that now we have multiple ways for students to take the survey. Sometimes we're walking around with the tablets. Sometimes we have the paper copy. And again, people would just come up to the table. You need to have those multiple methods because during lunch, everything goes really fast. So that was one learning that we had along the way.
Yeah, and it does help too with Wi-Fi capabilities because we do have one school that is a complete dead zone. So there's no way tablets would even work.
All right, well, thanks. We're gonna move on, but if we have time, we'll come back to have more questions for you guys. So thank you so much.
Thank you.
Okay, so next we have St. Mary's. Yeah.
You can you hear me now?
Yeah, I can hear you.
Okay, I'm sorry, this is Marge. I'm working on a little tablet because my computer is going back to Dell to be fixed. So pardon me if if I'm a little uncoordinated here. We call this we're calling this a common sense approach to local data collection because from the very beginning of SPIF, local jurisdictions have been asked, to gather data at the community level through focus groups, key informant interviews, surveys, et cetera. And while and I'm speaking on behalf of St. Mary's County, as well as Frederick County and Baltimore County, we all agree on the potential of local data. We know, as do our colleagues around the state, and as Calvert has already said, data collection is time consuming and it can be resource draining, both in terms of time, of money, and people. So we tried to come up with other ways. Next slide.
So this is Mary Ellen Crease, and can you hear me?
Yes.
Okay. So I'm the prevention supervisor at St. Mary's County Health Department. So I have been doing prevention in St. Mary's for 5 years. We are located in, if you're unfamiliar, it's a peninsula, and Calvert County is our neighbor on the north, sort of the northeast side. But we are surrounded by two rivers on either side, the Potomac and the Patuxent. So we are the home to Patuxent River Naval Air Station. So there's a lot of technology companies. There is a four-year college in our community, St. Mary's College of Maryland, and Southern Maryland Community College Leonardtown campus. So we have a variety of population as well, with just over 110,000, and 78% in 2019 were recorded as white, 14.7 Black, 5.3 Hispanic, and 2.9 Asian population. So we expect and hope that our 2020 census will reveal more, absolute population data, so we can get a better idea, because we know that our Hispanic community is growing as well, just by doing the outreach that we do. And we also have a lot of veterans, because we do have a Naval Air Station and we have Charlotte Hall Veterans Home. So we do notice a lot of seniors that are veterans in our community. High school graduates rate is 89.8%. bachelor's, individuals holding bachelor's degrees is about 31.5%, and our median household income is $90,000. That was in 2018. So with the high technology companies and the base, there's a lot of officers and individuals with higher incomes. So, and then of course, you have areas where there are lower incomes. So it's a good mix in our population that we're dealing with, and we have to take into account, what the needs of the community are based on that, the population and how it's, how that is broken down. So some of our partnerships that we have, of course, very closely with our St. Mary's County Public Schools. We have a private high school. We have some private grade schools that we do outreach with as well. We have our sheriff's office, of course, law enforcement, and the colleges, as I mentioned, our Department of Aging. So we get to reach out to our senior populations through our senior centers, and also MedStar St. Mary's Hospital. We do a lot of outreach, and how they actually host our Community Alcohol Coalition out of the hospital. So very strong partner in our community. And our public libraries, which we utilize for a lot of survey venue, which is a free venue, and we can do a lot of outreach with people walking into the libraries. And of course, there are, many, many more different organizations we work with as well. So I'm going to turn it back over to Marge.
Okay, next slide, please. We call this approach the opportunistic data collection. And while we do collect data in many of the same ways as Calvert County does, we've decided just to focus this discussion on one very specific type of local data collection. As Mary Ellen talked about, the geography and the demographics of St. Mary's County, and I mentioned earlier resource considerations, all of these things gave birth to the idea of creating an easy data gathering mechanism that could reach the people who might not otherwise respond to MPOS or MISA surveys, or who wouldn't necessarily be out in the community where we could find them. And we wanted to do this to determine, to the extent that we could, if the secondary data that we do have reflects points in time in the community, and asks questions that MISA and MPOS might not. For example, gauge the community knowledge of and support for a social host ordinance, which is certainly not in any MISA survey or anything else, and data that would capitalize, and an occasion, things that would capitalize on action which were already involved in the community and able to meet face-to-face with the target populations. For example, as Mary Ellen mentioned, senior citizens or parents of elementary and high school youth. And we really don't have, particularly with the MISA, a way to gather data on parents. Next slide, please. So how we developed the measures, what we did was we reviewed the outcomes and I identified the MPS and MISA questions that would fit, and we recognized that not all data collection opportunities attract the same target audience. So we opted for, in our opportunistic data collection, a menu of questions approach, in which we first, and as I said, we reviewed and anticipated MPOS, MSPIF and OMPP short-term and intermediate outcomes. And rather than develop untested questions, which would not necessarily meet reliability and validity standards, we opted to extract MPOS and MISA questions that specifically address anticipated outcomes. Each year, the St. Mary's County Health Department staff participate in a wide range of community-based events and activities, and that attract a large number of the population. we view these events as prime opportunities to gauge community knowledge and practices related to the outcomes in which we're interested. For both OMPP and MSPF, we develop this menu of questions. And for each time we go out, we look on the menu of questions and say, which of these questions are most relevant to this particular audience? And for example, as the event would relate to social marketing, we would take questions about our social marketing strategy and see whether what we were doing or what we were doing in social marketing was being picked up in terms of the community. And we also developed, for example, as another example, we developed a safe storage and disposal prescription medication survey for an event at a senior center. And similarly, we used a survey of knowledge of youth alcohol use and perceptions of the social host ordinance, as I mentioned, at a multi-school event for parents in high school freshmen. Rather than submitting an abstract modification each time we wanted to survey a particular group, our abstract modifications, and we had one for OMPP and one for MSPF, posited this approach and provided the menu of questions, the large menu of questions, as well as a sample, as well as a sample. Next slide. Next slide. Okay. So while waiting for IRB approval, which took quite a while, we brainstormed the target populations we wanted to reach, and we identified the venues in which they might be present. Most of the events are already on the calendar because there are things we do every year and events we do every year. Thus, we're able to do data collection without adding staff or other other costs. Among the events that we gathered data, these are just some of them. We did Department of Aging Wellness Fair in 2018, and we had 99 respondents. And the Wellness Fair in 2019, we had 140 respondents. And the Rising Freshman Orientation event in 2019, which was conducted at 3 high schools, we had 101 respondents. And that same event in 2020, we had 44 respondents. And for a small county, I consider that to be a good response rate. As people approached the table, staff invited visit complete survey, which was adjacent or is usually adjacent to a stamp poster that says, please help promote health and safety of residents by sharing your thoughts and perceptions about substance use issues facing county residents. Your responses are confidential and anonymous. And we don't use community surveys on youth under 18. We've made a conscious decision not to do so, although we have collected data from youth in focus groups, youth who are members of the, and you'll have to correct me if I'm wrong, if I say it wrong, Marianne, the Superintendent's Student Advisory Council. And,
yes.
Yes, okay. Respondents on these various occasions completed paper and pencil survey, as well as electronic on tablet surveys created in Google Forms. And we also did a survey during the summertime on using SurveyMonkey to gather data on youth mentoring. Next. Next slide. We rate the survey process as being very successful, actually, particularly in terms of the, wait a minute, I've got to do something with my screen here, and I don't like using a finger pen. We rate the survey process excellent in terms of the ease with which we're able to design a survey and bring it to the community quickly and efficiently, as well as to target the people from whom we want to hear. And as I noted earlier, the response rate is excellent. In that regard, I want to mention a couple of other local survey opportunities that I've been involved in, one in Frederick County and the other in Baltimore County. And in following the same brief survey strategy, we found that offering self-addressed stamped envelopes, stamped survey with, oh, I'm sorry, I'm getting a very bad.
I got it. Someone actually, I fixed it.
You fixed it. Oh, you're such a good fixer. In Frederick County, we, as cars drive through, we give them a survey in a self-addressed stamped envelope, and at drug take-back events, and through that we garnered an almost 40% response rate, which I think for a mail-in survey is excellent. As well, a Baltimore County parent community survey was distributed on occasions throughout the county and via an electronic version advertised through Nextdoor and available online. And that one garnered 903 responses, half hard copies and half electronic. So there are ways to get a lot of response. You just have to go to where the people are or figure out where the people are. Next. Oh, a minute, stay on that one. In terms of results, we looked at the results of the surveys and tried to, and in some cases, when we had secondary data, we tried to compare them. So the bar graph shows that, the column rather, shows whether parents and youth had the same sense of where students get their alcohol, where they get their alcohol, or actually that slide is not that. That one is self-reported use. And it was interesting to us that the blue and the green, there is no green, the blue and the yellow survey columns show how the parents reported in 2019 is blue, 2020 is and the youth, the YRBS data is the third column, the second set of columns where there are three columns, that's youth self-report. So obviously we discovered parents think that kids are drinking a lot more than they're drinking, at least the middle school students. Another interesting piece of data we found, and those are in the pie charts, is we asked senior citizens whether they knew the location of prescription drop boxes in St. Mary's. And almost 60% said they knew, while 40% they didn't. And in the pie chart, we asked them whether they used prescription drop-off boxes, and 60% said no, and 40% yes. Now, that's just a little, that gives us food for thought. It's not necessarily definitive, because if you know where the location of a drop box is, you don't necessarily have prescriptions to drop off. However, it is an indicator that people may not be doing what we would like them to do, and it may require sort of different messaging to adults, to say, giving them a more fulsome call to action about get rid of your prescription. Okay, next slide. We were asked to give tips, and my tips would be to use summer months to identify and calendarize data collection opportunities. Where are you going to be in the community? Where will you see people? How many people will you see? What's going to be the cost benefit ratio? And then contact other partners to learn about their plans for the year, where your target populations may gather, and how you can use their occasions again, and review your objectives and the data you receive from other sources. I know, and I agree with Denise, that more data is better. It's better to have more data, and whatever you can gather, you can, but you want to figure out what the data may tell you and what the data may not tell you, and whether you can do other things to stimulate the responses that you want from them. I think that's it. If there are any questions, I didn't see any pop up on the box, but Mary Ellen, anything to add?
No, Marge, I think you did a good job. The only thing I think you may have skipped over were some of the challenges that you may want to describe. If you have any you want to add to that.
Well, some of the challenges, collecting data consistently in a timely manner is, unless, and as I put that in the tips, unless you really have think of a calendar of what you want to do and when you want to do it. These events roll around and you're sort of scrambling at the last minute. The other challenge that we had last year was dealing with unanticipated events, one of which was not knowing for several months whether we even had the go-ahead to do any of our strategies. And the second one, as you all know, is our current situation, where we no longer have access to the target populations in a one-on-one way, and where Drug Take Back Day was canceled, and other, senior events and all of the other kinds of events at which we were going to be able to collect data. We can't do it, and we don't know when we're going to be able to do it again. So we may want to rethink this and think of other ways to get out these brief surveys. That's it.
Great, Marge, you might be able to you can help answer one of these questions about your experience with gaining IRB approval for primary data. If you want to go, and then maybe you can both give your IRB experiences.
Okay, well, first of all, it takes longer than you think. Second of all, it's always good to very carefully follow the format in the sample that we were given several years ago, and I'm sure I would hope that everybody has that. Third is just to be really very clear about what you want to collect and why you want to collect it, and give good examples, and have all of your ducks in a row in terms of the pressure to use, and the how you're going to train people and everything. And the IRB, the abstract modification template, is really very clear, and Nicole and her group are good at assisting you in that process. There's also the need to get internal approval, and in one of the counties we were not able to get internal approval to do this data collection. And I recall I don't remember if it was in Calvert or St. Mary's, it took a long time for this to go through the whole health department process and what have you. And then, as I said, if you're going to do it, and if you're going to go for IRB approval, you need to give yourself at least 3 months or more. A 4-week to 6-week turnaround time is not at all efficient. And you need time to do it, and then you need to give at least 2 months for the state to do its thing, unless things have changed a lot.
Yeah, and I will say we have.
I'm sorry, Marge, did you want to add the benefit to doing the menu of questions for the IRB approval?
Well, the benefit was we didn't have to go back and ask every time we wanted to do a survey, because they approved the menu of questions, and we said directly, and we gave them a sample of this would be a 7-question survey out of a 15-question menu or 16-question menu. And having approved that, then we could make we could create any survey we wanted within those parameters, and we didn't have to constantly go back and ask IRB approval for this one or that one.
Nicole, it's Brooke. I wanted to jump in here because as Marge was talking about just the time that things take, I wanted to reassure everyone that if you think about the SPIF process just in general, that it does move at a snail's pace. None of this is meant to be quick, right? And so when you are implementing your strategies, each year, do not think in terms that there has to be a completion of something at the end of the year. The purpose is that you are working through the steps of the SWIFT process, that there's evaluation, that things kind of happen, kind of simultaneously, and it's kind of back and forth, and you're assessing and you're evaluating, and then you're revising your strategic plan, and you're implementing in a different way. And so the point of me saying this is to piggyback off of what Marge was saying, in that you just have to give yourself time, period, for everything. And don't think again so we don't want it to be a rush for you to do any single activity that you are doing. That's the purpose of you planning. And each year, as you for a particular strategy, let's just say social marketing or whatever, if you have as long as you're doing the steps, you're fine. So it's okay that you don't always come out with the actual campaign at the end of the year, because you have all of these other things that you have to do to get that campaign where it needs to be for you to implement it. And the same thing again goes for other strategies. So always remember to give yourself the time, and put in, I can't remember the little, the saying about measuring. Was it say measure twice, cut once, I think it is, or something like that. It's kind of the mentality that you have to use doing all of this work. Constantly making sure that everything is in order before it's finalized. That's all I wanted to say.
Yeah, so I'll answer Charlene's question about basically to make sure we are tracking our process measures effectively. That's a component of it, in the sense of your process measures are really helpful to be tracking of if what you're doing is following like how you planned. So, are we following the steps of this strategy? Are we reaching who we wanted to? So if you wanted to have so many sessions and you only held 2 and you wanted to have 5, then that allows you to have that feedback loop of, well, what happened? Like, what adjustments need to be made? And that's why I need to collect that type of data to see, are you reaching who you need to reach, and at the frequency that you planned. The other part of process really helps you see is if what you're targeting in terms of change is occurring. So some of those quality assurance checkpoints of especially when it comes to messaging of, are people seeing things? Are they recognize it? Do they know what they mean? That's why that's so important, especially for that type of component. In terms of overall evaluation, you want to always include evaluation steps in your planning. We always say this, that implementation, the process part of implementation isn't just like programmatic. I think we sometimes think that as soon as we are there, but planning and evaluation are 2 huge components of implementation. So you always want to include those steps. And in regards to planning, it also goes back to what Marge was saying in terms of planning how you're going to evaluate and sort of incorporating those steps into your overall plan. Denise, did you want to add anything in terms of IRB?
Hold on, I have to take myself off mute. I agree with everything that Marge said, that you do need to allow enough time in the process, and the script that you all give us, that very clearly say input here, that is extremely helpful. So I don't really think, I think only once I had a question come back about IRB or something to add in, but it's been a fairly seamless process, but yes, a timely process, I would agree with. So, and I love the St. Mary's presentation about the menu, the survey that has like a menu of options that can be, added or taken away, questions put on and taken away based on the community that you're with. I think that's brilliant. So I just love that.
Hey, additionally, I wanted to remind everyone that when you are going through the IRB process, or sorry, developing your tools, yes, you need to, encourage you to work with BERT to do that. But also remember that those things need to be, as part of your conditions of award, those things need to be shared with us and approved by us before you move on. So just reminding you that that's part of the process too, is to share that information with us prior to submitting it. Well, for block grant, you're submitting it yourself, but through OMPP and whatever we have left for SPIF PFS, you'll be submitting it to us. That's it.
Yeah, and then one other question to Calvert, I guess, if Ashley wanted to answer this, is back to when, I think it's just a clarification of, you mentioned obviously that the survey can be administered in several ways. So is there a way that you make sure that one student doesn't take the survey in the various formats?
I mean, you're always, no matter what, when you have an anonymous survey, you run the potential of repeated surveys from the same individual because it is anonymous. There's no way that you can tell otherwise. I mean, you could just be active when you say, you know, only fill out one time. You know, if you fill out a paper form, you don't need to fill out an online form. But unfortunately, in just the way of statistics is, you're always going to have that margin of error to kind of compensate for those types of inconsistencies.
And I'll add to it that when I've been in the lunchrooms administering the survey, you know, if I'm going around with the iPad and I go up to a particular table saying, would anyone like to take a survey? Usually if 3 or 4 people will say, oh, I already did it back at the table at the back of the room. So the kids kind of are, at least in this example, they're kind of in their own world, want to be with their own friends. And I would be surprised if they took it more than once just because of the population that they are.
Okay, does anyone else from the group have any questions that they want to ask about how St. Mary's or Calvert have conducted collected primary data or any about their evaluation process? If you come up with questions that you want to ask them, you can obviously reach out to them or reach out to us, and we can then definitely share that. But as a reminder, there is the email group that you can always send a question out, and then that goes to everybody. So I believe, Brooke, that everyone that's been updated so that you can send it out to that Google group listservs. Ashley has a question. If a county has an IRB survey, can other counties use it? So one of the things that we have discussed to look into is to potentially update the put in an abstract modification for the umbrella to put in approved surveys and sort of that protocol. So the thing is that you want to get it, you'd have to make sure that you are able to follow if it gets exactly how it's approved in terms of like the method of the dissemination, how you making sure that it's collected the same, that the survey looks exactly the same, to make sure that it follows that IRB approval. So we can look into that. I know that we can definitely work to see now that's really only going to come down to OMPP. For a block grant, there is no umbrella protocol. So every jurisdiction needs to put in their own IRB application. So therefore you're all not connected to an overall application, so it wouldn't be like a shared modification. So if it's feasible to, so we could look into that because we have included secondary data that obviously is covered under the umbrella protocol. So we could have some discussions about what would be, we could review and make sure that the survey and the protocol is in good stand-in, I guess, and that looks like it could be possible. And then that would be added that everyone could use that survey questionnaire. But like I said, you'd have to make sure that if you use it, you have to use it in the protocol described in the IRB. And so I guess back to Marge real quick with the menu of questions, due to provide more information to the IRB, which you did. So can you explain how it's not that you also included the other components?
Yes, that's one of the components in the abstract modification package. You have to give a whole procedure, and we give them the survey method. As I said, we give them samples and of the survey itself, and then we spell out the process. You know, these will be distributed this way, this way, this way. This is what will be said, etc. This is how the data, you know, this is how the data is handled. These are the places where the data is stored, and all of that. And yes, that's part of the abstract modification. So it's there.
Great. So if that's something of interest, we can definitely further discuss, and let me know if you guys think that us putting in, like our team putting in a modification to the overall application to maybe have a couple, like a standard question and protocol. But like I said, it only really could be for OMPP. So would an IRB amendment be required to shift from an in-person survey to an online format? Unfortunately, yes, because of just like it has to list like the protocol, but it's pretty simple. It's just that one part of you updating how your survey collection, and if there would, and because you have to share what online service you would be using, if you're going to be changing any of the disseminations, and if you're doing online, if you're going to be having any advertisements, like what is your recruitment method? It probably might look a little different than you going in person. So that's why all of that would need to be submitted to IRB. But IRB is still functioning, so we will be able to. Sure, Denise, we can definitely follow up, and if with that follow-up evaluation meeting, of people interested. So, all right, let me see here. If you have submitted IRB, has COVID delayed its approval? So far, we have not had any impact to submissions that we had submitted recently. The IRB is still running. It actually, we just have to submit it electronically because we can't turn it into them. So you just have to send it over. So that we haven't actually formally sent anything remotely, but they still were on the same kind of timeline of being able to approve and to review submitted modifications. So
Nicole, you did just submit one electronically.
That's what I said. Well,
oh, I thought you said you did not. Sorry.
Well, that one was resubmitted. It technically, yeah, okay. It wasn't initially submitted electronically. So just as a reminder, if you guys have any other questions, even if you want to let us know maybe what we did provide as a reminder in that evaluation resource guide at the back are some sample evaluation questions that jurisdictions have used. So that can be a starting point, as well as process measures for specific strategies. So that's could be helpful when you're planning your FY21 applications right now. And then definitely reach out if you have any comments or questions or suggestions to any of us at BHRT, and feel free to check out our website. Like I said, there are other evaluation tools on the website under resources, as well as our Facebook page. And then Brooke, real quick, there's a question for you.
So the modification time period was extended to April 30th. So you want to hurry up and get in any modifications really quickly. because of course there's still the process of our office reviewing it and submitting it. Charlene Jones says she has a question.
Sure, Charlene.
You could unmute yourself and just ask it. It might be quicker.
You're muted.
Okay. Hello? So my question is, we have been told that we are not allowed to run any of our social media like commercials beyond June 30th. So anything that we pay for has to be aired and completed by June 30th. So one, I'm wondering, is that accurate? And well, I guess one, is that accurate? Because especially right now, with everything trying to be rushed, because all of the stuff we were going to do, we can no longer do. So our best strategy right now will be our social media campaign, because it's, you know, we don't need to be in an office to do that. So that's my concern, is being able to use funding to extend those those commercials through June. But and my other concern is, you know, our social media programs are probably a little bit more effective in our county during the summertime, because, you know, that's where most of our youth are out of school, at home watching TV. We don't have not many people here travel outside of the county because they can't afford it. So if we can air commercials and things like that during the summer, we are missing a pertinent time when we have access to our young people. So if that is the case, what is it that, you know, we can do in our county to get that adjusted? Because I mean, that's just the best time for us to market that strategy.
Charlene, we may need to talk further offline. I think it's the second time I'm hearing something like this, but the first jurisdiction that said it mentioned that they received, I guess, permission to extend. So I get the first question I would need to know is how, who told you that, one. But again, I think that's a question that I need to probably address with you offline, and I'm sure other people might have it too. So I can follow up with you after this. Would that work?
Okay. Yes.
And then I think Takesha Collins says she had a question. Is it related to evaluation, or is it more specific to administrative things?
It's IRB related.
Oh, IRB. Okay.
I need to mute Charlene. Okay.
All right.
Okay. My question was, we submitted our IRB request in June, February, for us to continue to do surveys, resubmission of the same IRB last year. It just expired. We made one modification to it. We haven't heard any steps of we can go ahead and start with our electronic surveys. Our PSA has already ran, so we're trying to survey the people while they remember.
Are you submitted to us, or it's already been submitted to IRB, is what you're saying?
No, I submitted it to you and Nicole. I did like CC'd it to you guys.
Okay, we'll look into that and get back with you. And we apologize if you did not receive a response.
It's okay. Thank you. Be safe.
You too.
All right. Well, thank you.
You gotta answer that.
Everyone.
Do you learn about charity?
Go back to the muted.
I think that's it.
Yeah, we're just getting an echo, but all right. Well, thanks everyone. Feel free to reach out if you have any questions.
Thanks everyone.